Hello, everyone. I'm Dr. Diana Bitner. I am co-founder and CMO of True Women's Health, and I'm very excited today to introduce you to Khyria. So Khyria is a brand new company that we're starting to reach as many women as possible. And I want to introduce you to Khyria as well as my co-founder, Maria. So Maria, welcome today. I'm really excited for you to give our audience a bit of feedback. Most of them know that I'm an OBGYN by training and very interested in women's health and reaching, again, as many women as possible so they can know what's going on with their bodies and how they can feel their best. So I'd love you to talk a bit about yourself, and then we're going to introduce Khyria.
Excellent. Thank you very much, Diana. Hi, everybody. Thank you very much for having me. Love being on an episode of Let's Chat, which I love. So I'm Maria Arvanitidou. I was initially trained as a pharmacist and then turned into health economist, later on a strategy consultant, and in the last decade or so, an entrepreneur in technology companies, most recently building Khyria with Diana. So I've really spent my entire career working in digital health and mainly at the crossroads of data, technology, and healthcare services, building tools, digital applications, algorithms for different populations, diseases, life stages, with an emphasis on how do we make sure prevention and early intervention is as easy as possible for as many people as
Which
possible.
is just absolutely amazing because, as you know, my story, as more women were aging, my patients were aging with me, and I wanted to be able to answer their questions. And I wasn't trained in prevention. I wasn't trained in menopause and sexual health. And so as I learned what actually is possible in terms of what we do know, then creating the small program, in West Michigan, and then learning about this big, great world out there of all these people doing research in women's health. And as we developed waypoints, as we wrote the book, as we developed the clinical protocol, and then left the system to start True, it was my goal of how can I reach more women? And all of your expertise is exactly what is needed to put us together, having the clinical background and then all of your background. I joke that this is a marriage made in heaven. And together, as we found and developed True, or rather Khyria, with also our business partner, Alin Lebster, it's just so exciting to see. So again, let's talk about Khyria and more of your vision. Maria, why do you care about this?
I love what you just said about reaching more women and expanding what we know works at a personal level when we meet the patient in the clinic. So for me, a big part of it had to do with how can we translate that intimacy of the relationship between a physician and a vulnerable person, whether they are a patient or not a patient yet, into a digital experience that can handhold people through very important and vulnerable transitions in life. Midlife and menopause is one of them. And also when we look at technology innovation from a business lens in healthcare, we typically start with identifying large unmet needs. And for women's health, this sort of happened years ago with fertility and pregnancy, which received most of the attention and investment dollars in the last couple of decades. But when we started looking deeper into the numbers and the stories of women beyond reproductive years, we discover an enormous data gap that becomes worse and worse as we move from pregnancy and childbearing into healthy aging.
There's such an unmet need. Women just feel so alone. They feel isolated. They're having these symptoms of hot flashes and night sweats, and they don't understand. They feel very alone because people aren't talking about this. And, for physicians, most physicians don't think it's an issue because patients don't bring it up. And so there's just such a gap in healthcare, in giving women language of how to talk about this. And it's been so exciting, again, on a more micro level, at True, we start our visits with, what do you care about? What do you want out of this? And what is hard for you? And then we go through those symptoms. And women, first of all, will have the aha moment of, I didn't even know this was a thing. I didn't know that the hot flashes were associated with hormone changes. So again, I love that you get how we start by personalizing this program for a woman, but then how do we scale this to reach just populations of women?
I think it's amazing what you just described because, even if I think about it from a purely scientific and business lens, and one thing I've learned is that if we cannot quantify something and share it as a number, we eventually end up doing nothing about
Agree.
it. And for me, one of the most important elements that I saw as an opportunity to create a digital program based on your clinical process was that I wanted us to use data to tell women stories and give them an aha moment, not a this is a list of things you should do
Right.
when you leave the practice or close the app for today and
Right.
that's it, go away and figure it out. And I think that's the bit that is very important to drive meaningful change.
Right. First it's just that more feeling conversation of how do I want to feel at a future event? But then how can we quantify it? And to your point, I love data as well, is how can we help women set a goal, but then make very actionable steps, based on evidence, based on research, and then make it about her. So we talk about different populations of women. There's women the majority of women who live in West Michigan that are maybe a certain background, but then there's women of color, women of Asian descent, women of Hispanic descent. All these cultural and socioeconomic factors come into play. So not only how can we reach more women, but how can we reach more women in a personalized way? And that's what we're both on the same page about.
Absolutely, absolutely. And I think when we brought up the word phenotype and being able to use data and measurements to understand what is most likely to work for a woman, and use tools to record what people's needs, wants, personal barriers are to enrich that data set to allow it to be more personalized in terms of what it recommends to
Sure.
people. I think this is where the magic started happening.
And that's the number one, is women want to know. I'll joke that, we women, we don't want to be told what to do. But give us the information. Tell me about what's going on under the surface, inside my body, and then give me the opportunity to make choice. Am I okay with a certain weight? Am I okay with a certain activity level? How does that impact how I am at 60, 70, 80? How do I want to live? How do I want to age differently than my mother or my grandmother? So again, the opportunity with Khyria is not only are we collecting data from women and what they want and how they feel, but also tracking physiological data. How often are their hot flashes happening? How do they sleep? And then what is their muscle mass? What is their body fat? And so again, I think the best thing, let's just get into what Khyria is. We could talk about this all day. We live and breathe this. So let's get into the details of actually Khyria. So, first of all, we want to support women in their process through midlife and menopause. And, it's about, again, being the best version of themselves. It's not what we want for you, it's what you want for you. And that's what we want to support. Number two, we want to close the data gap. So we want to understand more and more and more what women want, what's going on in their bodies, and then how we can inform them best on how to do this, but then also to help others understand this and teach others. Again, our goal is to reach as many women as possible. And that also involves reaching healthcare providers, reaching payer system, reaching employers. How do we help everyone understand more? And number three, we're going to improve chronic disease. So we know that menopause is not only a time of a woman's life where her body changes and she'll have symptoms like hot flashes and poor sleep or pain with intercourse, but also it is the biggest risk factor for heart disease, for dementia, for obesity, for depression, for bone loss. And we really want to improve a woman's outcome and how she ages. So having said that, what I'd like to talk about is, our origin story. How did we come together? So, we met very serendipitously. Do you want to talk about how we met just for a second, and then we'll get into the details?
Absolutely. I think that we met mid-pandemic and sort of during a period of time that we were both looking for our missing piece, the partner who would make this complete, to build a team that is essentially the Swiss Army knife to creating a digital solution for female health. So I think when we first met over a Zoom call, we both realized pretty quickly that we complemented our respective experiences and visions. I think that the important thing about coming together was how quickly it emerged that bringing together the clinical and behavior change science with technology and measurements, which is the bit that we had spent the majority of time developing as a concept, as a team, to give us that longitudinal view of what happens in our own bodies and minds as we grow older, was what pretty much became the glue into deciding, okay, let's build a company together.
And then
it took us probably 4 months of going back and forth, trying to imagine what that could look like and what are the different components of the clinical process you guys work on at True, and go above and beyond just translating a clinical protocol into a digital experience. But really thinking about how people like to interact with technology to evoke the same emotions of being seen, understood, and guided, supported, not told what to do.
Right. And I just love how, just like in an operating room, there's all the different team members that make the surgery possible to happen.
Exactly.
Well, I think about Khyria as the same way. We have our digital, our engineers, our data science and our software engineers. We have business, we have strategy, so again, everyone, this is going to be so exciting. So again, let's get into exactly why we're here to talk about Khyria and what, Maria, do you want to talk about the digital experience?
Let's pull up some slides and show you a little bit more visually what Khyria is about. Khyria is all about owning your health with data and gumption, and we take that very, very seriously. So that's why we start with measurements. You've heard us speak about measurements quite a lot. So what does that mean? So Khyria starts with a device kit that is comprised of a wearable device. Any smartwatch can work with Khyria. A continuous glucose monitor that we provide that goes onto your arm like a patch and that you can use your phone to scan through. And a digital scale that also connects with your phone and allows you to take all of your body measurements at home in the same way you would do in a practice, also very, very frequently. So we use these measurements to monitor and understand your physiology, your activities, your daily lifestyle patterns, and your symptoms. So we can tailor a personalized AI-driven program to your needs, give you the knowledge through the app-based program that will allow you to get enough tips and guidance every day in the areas that matter most each week to give you education and knowledge in your fingertips, and also guide you towards other products and services that might boost that effect around what you need at any given time. What we mean by that. Sorry, go ahead, Diana.
Sorry, if I can just interject, it's like patients saying, okay, I'm drinking my water, I'm exercising more, I've lost a little bit of weight, but I still have hot flashes. What can we do about that? So as you feel hot flashes, and as we track hot flashes on the wearable, then it's maybe take a quiz to understand if hormone medication is right for you, if other medications are right for you. What does that look like? And it's be able to then take a quiz and then be able to ask your health provider more questions. And then we can even talk about, okay, once you've started hormones, oh, you still had a hot flash. Oh, maybe it was that glass of wine you had. And if we can then have your data around your blood sugar. So for example, women, let's say if they have a glass of wine before bed, their blood sugar goes up in the middle of the night, it crashes and they wake up with a hot flash. So it's giving you an actual reason why you felt the way you did. So then you could change your behavior the next day to make a difference, so you can actually sleep through the night the next night. So it's just this
Exactly.
personal
Essentially,
insight.
compiling that sort of complex insight through data that if you didn't have, it would feel like, oh my God, why did this happen again?
Exactly.
So we try and use this information to show you the way to change certain things in order to feel better.
Perfect.
So on that note, one of the reasons why we're here today is because we'd love you all to get involved in the making of Khyria by giving you early access to the experience and really helping us impact the lives of more women like you. So inviting you on our first private beta program. What will that entail? So while you're watching this or straight after our webcast, you can go to khyria.com, take a very short assessment that will focus on symptoms, certain demographics, will take about 5 to 10 minutes, and that will sign you up onto our waiting list for the beta. And around the middle of June, the first batch of you will start receiving emails with instructions on how to download the application and start using Khyria. Essentially, we will continue in batches of about 20 every couple of weeks throughout the summer. And once you get onto the app, like the first few bits that you're going to go through is, as Diana mentioned, a couple questionnaires to get to know you better. A few questions about what matters to you and setting your milestone events. People who have been patients of Diana and Drew will probably recognize some of these references. And that will give you access every single week to a weekly program of routines and little reminders of things to do throughout your day in the morning, afternoon, and evening in order to maintain your lifestyle goals that are focused around the 7 essential elements of daily success, also based on Dr. Bitner's clinical process. So every single day you can visit your articles library and get fresh content around the areas you are focusing on any particular week. And gradually, it's sort of gamified and allows you to level up little by little in individual areas, build up your goals, and go explore more lifestyle areas as your life symptoms and circumstances change. Every day, you can also access daily insight. These are in a very fun form of stories, almost like going on Instagram or Facebook, but they focus on giving you actionable tips and hacks on how to deal with the most bothersome areas, and also highlight key metrics that are impacted by your daily behaviors and giving you helpful nudges on how to turn those trends towards more positive ones that help you feel better. And because one of the things we've heard from you is that you really love things that are fast and easy, we have introduced power-ups as part of our first version, which is essentially, what can I do today that will take 5 minutes and help me feel much, much better? So this is one of the parts of our content that we're most proud of, as we hope is going to solve an enormous issue for a lot of us who are a little bit tight with time, trying to do good for ourselves and our daily behaviors.
Well, what we've seen is that, women will learn about the seeds or their 7 essential elements of daily success, but it's, how do I incorporate this? It seems like a lot. I can't do everything at once. And this is such a gift because it shows women how they can gradually add these to their life, not everything all at once. So gradually drinking the water.
I think it's also a very pragmatic approach, right? None of us can be perfect, achieving their goals in absolutely every lifestyle area at all times. And certain areas, as we've discussed plenty of times, are more important for women with specific characteristics during this phase of their lives, and they should focus on those more to see changes. Some other combinations might be best a few weeks further down the line where we've fixed one area, something else has popped up, or just life happens.
Right.
So we wanted
But
to be very cognizant of that.
100%. And, as women start to feel better, then it's establishing that habit. And as you say, then moving on to another one. And, it's not about achieving perfection. It's about having that baseline. Women, sometimes will say, I just want the magic bullet. I just want the pill, the medicine. But the more we talk, they really do understand that it's about having that baseline of a healthy lifestyle. And so it makes it an easy way to see how that will affect you as you go through this program. So, and again, too, I want to thank so many of you who have participated in the focus groups. So Elisabeth from our Khyria team led these focus groups to really understand what is hard for you. What are you looking for in a daily product? And it's been really helpful to see how we can develop this. And now, again, this is the next push forward to really get people using it and see how it works.
And thank you for reminding me. Yes, thank you to everybody who participated in focus groups. You will get more opportunity as a better user to give more and more feedback about what we're building.
Yes, we incorporated feedback from those focus groups in this
exactly
process.
In this very version.
Yes, so it's been just critical.
Exactly. So yeah, the process every week finishes with the weekly check-in, where we just ask you a couple of questions to make sure you've liked everything, to ensure that there are any things you'd like to change in next week, and then taking in all the data from the previous week, we recalibrate your program every single week. You see unique content different to every other user. And that process follows on and on and on as the product adapts to your own needs and different phases of life. So the logic behind Khyria was that we wanted to build a tool that is equally helpful to women as they're going through perimenopause, as well as after their final menstrual period, where some of their concerns and health issues have changed and they want to focus on different risks. So that's the magic about Khyria. It adapts with your needs and how you go through different phases of midlife.
Perfect. Well, so many women tell me that what's really difficult is they might ask the Google, tell me about hot flashes. And there's so much information out there. They don't know how to personalize it for themselves. And that is also part of the magic of Khyria, is making this about you, not about someone who doesn't have the same experience as you.
Absolutely.
So here's the process.
Yes, just to recap everything and make sure you have seen all the details. We're inviting all of you to join our exclusive beta program. The plan is to give exclusive access to 100 women to try Khyria over the summer of 2022. We might enlarge it towards the end of the summer, but that's our initial goal. Start with 100. Right now, what you can do is go onto Khyria.com to join the waitlist. And in the summer, look out for an email from Khyria. The first group will get it around middle of June, and priority will be established based on a few different criteria. Number one, it will be first come, first served basis, and will give priority to women aged between 45 and 55, between early perimenopause to early postmenopause. This will be the focus of our beta to begin with, and later on we'll be giving access to women outside those groups. True patients will be in the first batch to be invited, but the beta is not going to be exclusive to true patients. And also women who already own a smartwatch, whatever make, will be given priority in the early batches. That does not mean if you don't have a smartwatch, you will not be offered a place. You will be offered a place later on, and you will also be offered a wearable in order to participate. So what will I have to do as a beta user? Well, the first thing is you get to try Khyria first and for free. Very simple things. You just get instructions and download the app. We'll ship you the devices I talked about earlier. You'll just connect them to your app and commit to use the app daily for 2 to 3 month period of time. You'll have to tell us what you think. So that will be participating in one-to-one interviews, focus groups, doing questionnaires. I promise it will be a lot of fun. And hopefully by the end of it, you will feel and look a lot better and we would like to measure that. And so we'll be able to show you the impact of participating in the trial and help us move to the next stage to go to the hundreds and thousands of women who will get the opportunity to experience the next generation of Khyria.
And I get lots of questions when I talk to women about this. Well, what if I'm not 45 to 55? Can I still get this? And I just say, just hold on. We've got to really understand this for women who are in the phase where the symptoms are the most difficult. But as we develop this, of course, we look to expand this out to different age groups. So it's just very exciting to see how this will develop, and then we'll expand. So don't worry if you're out there and not in this first group. There'll be more, but please sign up, and we're really excited.
Absolutely.
You know, there are
Thank you for saying that,
78
Diana.
million women in the US in menopause, 78 million. And there's only 1,300 providers in the United States. So it's like, how can we reach more and more women? So we really need you, first users, to help us understand how this product will work. And then we get to offer it to women all across the country and all across the world.
Exactly. Tell us what you love. Tell us what you hate. Tell us what you'd love to see in future versions of Khyria. And of course, follow us on social media as we create some buzz as we grow.
Exactly. And please share this with your friends, you know, on social media. And again, as we get more feedback and we understand, we're just going to make it a better product. So thank you all so much for tuning in to our introduction of Khyria. This has just been a dream come true for me, to learn more and more and have people involved that know things that I don't know. This will take a village. This will take so many of us with different skill sets and different. So we really invite you to join us and look forward to the future. Maria, thank you so much.
Thank you so much, Diana, and thank you so much, everybody. Very excited about next steps in June, and look forward to another Let's Chat.
Great. Thank you so much.